So hello everyone, good afternoon. I hope I'm audible and visible. Please give me a quick thumbs up if my audio video is fine. All my dear students, please give me a quick thumbs up if my audio video is fine. And welcome in the next session of dermatology with me, Dr. Chesta Agarwal. Now today we are going through a marathon for the PYQs of FMG, and this is the session for your dermatology PYQs. Please give me a quick thumbs up if everyone is ready for the today's session. So I'm Dr. Chesta Agarwal, your Neet Pg educator on Unacademy. I think everybody knows me by now. I have myself scored All India rank 261 in my Neet PG exam. I have been co-author of dermatology in a very renowned textbook on pigmentary disorders, and I also have an All India Best Paper Awards. It's been almost 5 years. I have been teaching all sort of pre-PG entrance examination. Now, we also have Unacademy, also have various Telegram groups. I think you are aware about that. Please connect with us on those Telegram groups. We have two type. One is Let's Crack Neet PG, and another is Neet PG Live. Both are the Telegram groups of Unacademy, so please join us there. Now we have two type of subscriptions. One is Plus, and another is where is book, ma'am? Praveen, that is a pigmentary disorder textbook. You can buy it from any of the stores if you want, but not very useful for your pre-PG preparation right now. That is very useful when you get a seat in dermatology. So it's on the pigmentary disorders. Everything related to pigment will be there. Chalo. So you have a plus subscription on Unacademy, which give you an access to live classes of Unacademy from the top educators. You will also get an advantage of live test, quizzes, access to around 25,000 plus questions, and even you will get a printed notes if you buy a 12-month plus subscription. We also provide iconic subscription, which give you an access to both Unacademy and PrepLadder. I think PrepLadder is everybody knows about it. It has the clinical integrated essentials, video lectures, recorded sessions, question bank, rapid revision snapshots, treasure notes, or dream notes. Special class, I think you are all aware about it because this is right now we are in a special free class where all the subjects will be taught to you. You will have all the features like that of a plus class, like poll, raise a hand, notification, lecture notes, and accessibility with any sort of device. We have highly effective question bank of around 25,000 plus questions, and we have a detailed explanation of each of them. There are three mock tests or free grand tests scheduled for this month. One is tomorrow, that is Sunday, 24th October, 2 p.m. to 5 p.m. for INI-CET. FMG is on 31st, 10 a.m. to 1 p.m. And I think this one you already have given today. Anybody who have given this exam free test today, which started from 2 p.m. to 4 p.m., anybody has given it. This was a Neet PG mock test. We also have raise a hand. You can see it on the screen. If you have any doubt, you can just raise your hand and you can ask the doubt. The doubt can be recorded, and all the other learners and educator can hear at the same time your doubt. We have amazing learners with us who have performed very well. This was not valid today, ma'am. Which is not valid today, ma'am? Praveen, you have that feature, raise a hand. You can anyway go anytime go for the raise a hand feature. The new batch is about to start on 27th. This is the Neet PG 2022 batch and a clinical case discussion batch. Both of them are starting on 27th of October. I request all of you to please go ahead and get yourself enrolled. The next is we have Neet PG subscriptions that is of two type, iconic, which give you an access to Unacademy and PrepLadder. I request you to please use a code CHESTA10 if you are buying this because this code will give you additional 10% discount. For Plus, we have shorter subscriptions also like 3 months, 6 months if you want short subscriptions. For FMG, you can take a 3-month subscription. Please use my code CHESTA10 to get 10% additional discount. Okay, ji. Now coming to the next or the last part, I think Aruna, we will keep that limited to the Insta only. So right now we have to concentrate on studies. So I would recommend all of you to go for a 2-year subscription if you are planning for the next year or next to next year subscription, because that will be very cheaper for per month subscriptions. Okay, but whatever you take, please use my code, that is CHESTA10. Chalo ji. So let's start. Please give me a quick thumbs up. Please give me a quick thumbs up. So you all people watch so much of Instagram, huh? I can see that. Okay, fine. Chalo. Starting with the first question, you will have the PYQs which you have already got in your FMG exams. So many questions from dermatology we expect all the time. Please tell me what is the correct answer. A female student presented with urticaria following intake of seafood. She wants a non-sedating drug since this is her exam time. Which is the preferred antihistaminic for this patient? Which is the preferred antihistaminic for this patient? Chlorpheniramine maleate, promethazine, diphenhydramine, or fixofenadine. Very nice. Colleen, Umang, Oasis, Aruna, Yogesh, Lydia, Ravi, Shatnik, Dr. Sara, Dr. Tarek, Praveen, Poonam. Very well done, all my dear students. Very well done. So this is a frequent repeat. This question has been repeated in Neet PG, has been repeated in FMG. Okay. Now here the drug which you have to give is clear. It is antihistaminic. But all the four options are antihistaminic. So which will be your preferred choice? Please remember, you will prefer a drug which is non-sedative. And among the options, it is the fexofenadine, which belongs to second generation of antihistaminics. Can anybody tell me some more second generation antihistaminics? These are first generation. Other than fexofenadine, it is cetirizine, levocetirizine, even desloratadine. All these drugs, loratadine, desloratadine, these are second generation antihistaminics. Clear, all of you? Any confusion anybody has? No? Chalo, badhiya, amazing. Let's move to the next question of the today's session. This image was not there. The image was little different, but the question was same. So please tell me what is the correct answer here. You got a different image in the exam, but the question was almost same. Very nice, Devesh, Binolbin, Raj, Hari, Colleen, Meet, Goda, Dr. Sara, Dr. P, Tarun. Very well done. Please remember, here pay one question for sure in your exam. This year, Neet PG also, we got a question on tinea capitis. FMG, we are getting questions from alopecia areata. Twice and thrice we got the question. Even tinea capitis is very important. So whenever you see a patient with patchy hair loss, with absence of hair, this becomes a case of alopecia areata. So please remember, patchy hair loss becomes a classical case of alopecia areata. Understood or not? Okay. Now, if they say that the patch has scaling, mark the diagnosis of tinea capitis. If they say that the patch have few hairs of uneven length, mark the diagnosis of trichotillomania. So like that, you should remember all the differential diagnosis which is required for patchy hair loss. Please give me a quick thumbs up if you understood. Please give me a quick thumbs up, all of you, if you understood till here. Amazing. Let's move to the next question. Let's move to the next question. Can you tell me the answer here? A 70-year-old patient develops the following lesions over the face since 2 years. What is the diagnosis? What is the diagnosis? "70-year-old patient develops the following lesions over the face since 2 years. What is your diagnosis?" Very nice. Binolbin, Raj, Abhi, Lakshmi, Bhuvanesh, Colleen, Roop, Shatnik, Umang, Dr. P, Nikhil. Very well done. Very well done. Now, if you look at this, first of all, look at the site. It is the face. Along with that, you can see that the margins are beaded. Can you see the margins like this? Yes or no? So this type of beaded margins with an ulcer, a very classical feature of basal cell carcinoma, and it is a slowly progressive ulcer, and that is why you have 2-year-long history. Can anybody tell me, if I do a biopsy, in this patient, what will be the characteristic finding I'll see? If I do biopsy, what will I see? Very nice, Dr. Tariq. I will see that there are group or collections of the tumor cell with classical perpendicular arrangement of the peripheral cell, and this perpendicular arrangement of the peripheral cell is known as what? This perpendicular arrangement of the peripheral cell is known as palisading arrangement. Palisading arrangement. Shatnik, parakeratosis is not a feature of basal cell carcinoma. Please remember, parakeratosis you see in precursor lesions and in squamous cell, but not in basal cell carcinoma. Okay? Understood, all of you? I request a quick thumbs up if this question is clear. What is the answer here? What is the answer here? A young lady presents with lacy lesions on the oral cavity. Her proximal nail fold have extended onto the nail bed. What is your likely diagnosis? Very clear. I think in that question, they have not given you the nail fold finding, but they have given you an image of oral cavity and they have given you the history of presence of some papules, which are very, very easy. What is the diagnosis? Very nice. This is a classical case of lichen planus. Can you tell me what are the common presentations or what are the different P's of lichen planus? Anyone? What are the different P's? We have 5 P's. They are papules, which are purple in color, plain topped or flat topped. They are not round, they are polygonal. And they have itching associated with this, pruritus. Along with that, if you have white lacy pattern, it is known as Wickham's tri, very, very classical of lichen planus. Very, very classical of lichen planus. Is this clear, all of you? Yes, you're absolutely right, because we have 3 more P's. The other P's are pterygium. They can even form a plaque. Multiple papules can combine to form plaque, and they can leave behind post-inflammatory hyperpigmentation. So all these P's are with respect to lichen planus. Very commonly asked, very, very commonly asked question. Next question is here. Can you tell me what is the answer? Ulcer with overhanging undermined edges in the neck region. What is the correct answer? I request all my dear students, if you are targeting FMG, please do subscribe Unacademy for 3 months. All the educators are here giving their best, or they are trying to compile all the 19 subjects together, explaining the important part which is must for your exam. So if anybody is seriously taking the preparation of the December FMG, please get yourself enrolled. You still have a lot of time to read. So try to give one more revision with us on Unacademy. Please use my code CHESTA10 and get yourself enrolled. Okay, ji? Chalo. So in this particular question, they have told that the lesions are present on the neck. Whenever you see cold ulcers or whenever you see the ulcers or nodules without any inflammation with violaceous overhanging margin, it becomes a classical case of tubercular lymph node. It becomes a classical case of tubercular lymph node. Now, this is another question which has, I think, come in this June 2021. They have given you the image of face. This was not the image. They have given you the image of face where you have the white vitiligo lesions unilateral over a single part. So the question was very similar to this, but the site was different. And I think I've told you the answer. Please remember, whenever you see a single segment of hypopigmentation, it is known as segmental vitiligo. Now, there are many students who get confused between segmental and focal vitiligo. Can you tell me how to differentiate between focal and segmental vitiligo? Anybody here? Difference between focal and segmental vitiligo. So I'll tell you what is the difference. In segmental vitiligo, you will have involvement of a single segment or dermatome, and it will never cross the midline. It can be either on the trunk, either on the face, or on the limb, but single dermatome or single segment is affected. It will not cross the midline. While focal vitiligo will have small or focal lesions in more than one dermatome or more than one segment. Understood or not? Please give me a thumbs up if you understood the difference between focal and segmental. So please do not mark it wrong in your exam when you get an image. This is a clear-cut case. You can see that there's a single dermatome which is not crossing the midline. What is trichome? Praveen, what happens whenever you start treatment in a patient of vitiligo? What happens? You will see the normal skin color, you will see hypopigmented, and you will see one more color in between the normal skin and the hypopigmentation. Okay? So you have 3 different colors, and that is known as trichrome sign. Understood or not? What is trichrome? And sometimes you see that the pigment have overshooted the normal color, and you can see one more color that is known as quadrichrome. So please remember, trichrome and quadrichrome sign are the features of healing vitiligo or treated vitiligo. Causes of vitiligo, Olive, you have a lot of causes. There are multiple theories. The most commonly or the most expected theory is autoimmune theory, which says that autoimmune T lymphocytes destroy the melanocytes. Clear? There are many more theories like neurogenic, oxidative stress, physical theory or melanocytorrhea, but the one which you all need to know for your exam is autoimmune theory. Clear? So I hope I am clear with everybody's doubt. Please give me a quick thumbs up if everybody have understood the question till here. Amazing. Next question is on your computer screen. Fatafat se tell me the answer. A patient, farmer, gardener by occupation presented with the following lesion. What is your diagnosis? What is your diagnosis? What is your diagnosis? Very well done. Binolbin, Dr. P, Colleen, Olive, Goda, Dr. Arush, Lakshmi, Dr. Tariq, Bhuvanish, Nana. Very well done, all of you. Please remember the correct answer of this question is option number 1. So you can see that there is swelling. You can see multiple sinuses and they also have discharging grains, and this forms a classical triad of mycetoma. Okay? So please remember, it's a very, very classical feature of mycetoma. This question has been repeated so many times in Neet PG, in FMG, as well as in AIMS or, like in other central exams. So very important. And if you can notice that there are so many questions from infectious disorders, so this becomes a very important topic for FMGE aspirants. Okay, ji? So without infectious disorder, you cannot go and give your exam. Okay, it is very, very important for you. Identify the condition shown in the image. Identify the condition shown in the image. They have given you an image of something present around the perianal skin. Very well done. I can see a lot of you. Amazing. A good number of students we have today. I hope everybody is enjoying the marathon session going on right now. Am I right? So you all are enjoying this marathon session? Yes. Okay, ji. And we have many, many classes going on right now. I can see a lot of classes. Anyways, chalo. Identify the condition shown in the image. This is again a frequently asked question. Very nice, Dr. Tariq. This is journal what and also known as condyloma acuminata. Chalo, give me one thing or tell me one thing. If you get this patient in your OPD today, suppose if or tomorrow, if you go and attend your hospital, if you get the same patient, how will you treat him? How will you treat him? This is a HPV infection. What will you give? Very nice. Dr. Arush, you can give cauterization, either chemical or radio frequency or electrocautery. Okay? So you will ask this patient to either go for podophyllin application, which is a plant resin causes metaphase arrest. You can also suggest imiquimod, which is an immunomodulator work against toll-like receptor 7. And next, you can even give trichloroacetic acid, which is a keratolytic agent. These are the chemicals which can be applied. You can also go for radio frequency cautery, or you can also go for electrocautery. Okay? And lastly, you can also go for cryotherapy. Now, suppose the patient is a pregnant female. Can you tell me which among these options should be avoided? If the patient is a pregnant patient, how or which of the following treatment modality should be avoided? Anyone? Avoided. Please listen to my question. Which of the following has to be avoided? Please remember, you will never give podophyllin, you will never give imiquimod, because both of them are teratogenic. You will either ask the patient to go for cryotherapy, you can even ask the patient to go for trichloroacetic acid. Either of these can be asked. Either of these can be asked. Okay? Samajh gaye? Everyone clear? Definitely, cautery is always safe. so you can go for cautery as well, but it is best because this area is very difficult to be treated by cautery, so we always prefer topical agent. Now somebody was asking me how to differentiate condyloma acuminata from condyloma lata. Very simple. Lata means flat. Obviously, if you have to lie down, how many of you know Hindi here? What is leta in Hindi? Late jaw, right? To lie down. So just remember it like that, that leta lesions are always flat. They are flat-topped, moist lesions, while acuminata is rough. It is rough. Can you see the lesions here? Just try to examine them. They are looking as if multiple finger-like projections are forming a group. So this is how a condyloma accumulator lesion look like. And condyloma lata, they are flat-topped lesions. Clear? I think now you will not make any mistake. And also, condyloma lata are discrete lesions like this. Round, discrete lesions. They are not present in groups. So that is also a very interesting differentiating feature between both of them. Chalo ji, very nice. So we are done with this. Let's move to the next question. Identify the condition shown in the image. This was the question in December 2020. Last year, this was the question. So please tell me the answer. 2020 paper. So you have seen that in 2021 June, we got a question from basal cell carcinoma. And in 2020, we got a question from, what is the answer here? Very nice, Binaldin, Devesh, Goda, Dr. Arush, Shehtaz, Ashish, Dr. P, Bharti, then Abhi, Dr. Sana, Tawfiq, Samira. Very well done, all my dear students. Amazing, all of you. This is a classical case of malignant melanoma. Can you tell me what type of malignant melanoma? We have 4 types. Which one is this? Superficial spreading, lentigo maligna, acral or nodular. Which type of malignant melanoma is this? Please remember, this is lentigo maligna. Why it is lentigo maligna? Why it is lentigo maligna? Because lentigo maligna is seen on the sun-exposed regions. It is seen on sun-exposed regions in an elderly individual. And because of the sun-exposed site, the most frequent site, it is also known as Hutchinson's freckle. It is also known as Hutchinson's freckle. Understood? Okay. Ma'am, question advantage. I'm not able to understand, Reshma. This might not be the exact language of the question. I totally agree with you. But please remember, these were the topics from which you got the question. And that is very important for you to know. Okay? Reshma. So 2 questions back to back we are getting from malignancy. So भैया malignancy वाला topic तो नहीं छोड़ना है. You cannot take a risk of missing on malignancy chapter. Please subscribe to Unacademy and join my course. Go through the detailed discussion of cutaneous malignancy because subsequently 2 questions back to back from the same topic. Okay. Yes, topic are repeated. Obviously, topic will get repeated. You will not get exact same language all the time. You can get the exact same language also, but it is the topic which is most frequently repeated. This is again from 2020 paper, again from 2020 FMG. Cutaneous horn, as shown in the image, is associated with which of the following skin cancer? Very well done. Binol Ben, Devesh, Bharti, Qualeen, Shaitat, Shakti, Poonam, Ashish, Abhi, Raj. Very well done, all my dear students. Other options also. So, Arpita, you want me to explain the other options of this question or the previous questions? This question or previous question? Okay, previous one. Okay, definitely I'll explain you the options of the previous question. But first, I will tell you about this. Please remember, cutaneous horn is the excessive proliferation of the keratinocytes sometimes in a patient. As such, they are not malignant, but long-standing cutaneous horn can get converted into squamous cell carcinoma, and that is why whenever you get a patient of squamous cell carcinoma, of cutaneous horn, always you remove it and you will send it for a histopathological biopsy, because we need to know whether they have converted to malignancy or not. Clear? Please give me a thumbs up if you understood. Now the other options which is giving here, there's no confusion. I think basal cell carcinoma we have just now seen. The most common presentation is nodulo-ulcerative, Arpita. Nodulo-ulcerative is the most common type. Squamous cell carcinoma is usually the verrucous growth, and nevus cell could be epidermal nevus, where you have abnormal proliferation of epidermal keratinocytes, or melanocytic nevus, where you have abnormal proliferation of melanocytes. Any confusion, Arpita? You have asked me to explain the options. आगे बढ़े? Should we go to the next question? Anybody has any confusion? Okay. The next question is on your screen. Can you tell me the answer here? Auspit sign is seen in. Auspit sign is seen in. Auspit sign is seen in. Very well done, very well done. Please remember, Auspit sign is a classical feature of psoriasis vulgaris, not pemphigus vulgaris. हो गए ना confused? Please remember, Auspit sign psoriasis vulgaris का option है. What is pemphigus vulgaris sign? Nikolsky sign. Or bulla spread sign, acantholytic cell. But what is Auspit sign? When you rub the lesions of psoriasis, you will see there is exacerbation of these scales, and when you remove those scales, you will see presence of pinpoint bleeding areas. So that is known as Auspit sign positivity. Clear? Amazing. Understood, all of you? Everyone will give me a quick thumbs up if that point is clear. Very well done. Very well done. Let's move to the next question. And please remember that condyloma later question, condyloma accumulata question got repeated twice. It was there in 2022 exam as well as in 2021. Both the exams has a direct repeat of condyloma accumulata. Okay? Very nice, Dr. Arush, Colleen, Goda, Abhi, Poonam. Very well done. Faith, Shatnik, Abhi. Then we have Manoj, Dr. Sain, Lakshmi, Ashish, Surbhi, Anmol, Olive, Umang. Very nice, all of you. This is a classical lesion of pyoderma gangrenosum. If autoimmune causes for this, no bacteria. Yes, you're right. Not autoimmune, Dr. Arush. I will not say it is autoimmunity. It is the neutrophil accumulation. Neutrophil accumulation can be because of anything. It can be because of some infection like Streptococcus. It can be secondary to malignancy like AML, AL, or it can be because of drug like GCSF or GM-CSF. Okay? So neutrophilic dermatosis is the neutrophil accumulation in the skin, either epidermis or dermis. Okay? I hope this is clear. Very interesting. Again, we have seen repeated questions from pyoderma gangrenosum sweet syndrome in your exam. So all my FMG students, please make sure cutaneous malignancy, very important. Infectious disorder, very important. And third is neutrophilic dermatosis, which is very important. Okay? After that, psoriasis and pemphigus. These topics, at least these topics must be done before going for your exam, because from dermatology, we almost get 8 to 10 questions. So which is a very good number to get 8 to 10 questions from such a short subject like dermatology. Clear? ठीक है जी, समझ गए? Very nice. Okay. Now coming to the next question. The most common complication associated with the following condition: post-streptococcal glomerulonephritis, staphylococcal scalded skin syndrome, encephalitis, or pneumonitis. Which of the following is the common complication of this condition? Can you tell me what is this condition? Anyone? Yes, it is non-bullous impetigo. Can you tell me what is the cause for non-bullous impetigo? Anyone? What is the cause of non-bullous impetigo? Can anybody answer this? It is not staph, it is strep. Streptococcus is more frequently present. Please remember, Streptococcus is more frequently present. And in Streptococcus strain M40 is the most common cause for post-streptococcal glomerulonephritis. Understood, all of you? Very, very important is the post-streptococcal glomerulonephritis. I hope this question is clear. This is again a very frequent repeat. This question got repeated in FMGE, Neet PG, back to back in 2 years. Back to back in 2 years, so it becomes a very important question. I don't want any one of you. So, what is the next important topic? Genodermatosis. Genodermatosis like neurofibromatosis, tuberous sclerosis, then we have Bloom syndrome, Cockayne syndrome, xeroderma pigmentosa. Okay, so these becomes very, very important, these topics. Even ichthyosiform disorders are very important. Now, you all must be wondering that, ma'am, aapne sari topic le liye, what is left? Okay, ji, fine. So this is a case of xeroderma pigmentosa. And if you remember my yesterday's class, I told you in xeroderma pigmentosa, you have to always look for what? Freckles. There is a lot of freckles which is present on the face, okay? Along with cutaneous malignancy, scarring, photosensitivity. So this becomes the correct answer. And I think one more question is left, and then we will wind up the today's session. Can you tell me what is the answer here? Yes, absolutely right, Dr. Tariq, Dr. Arush. Very nice. I can see 68% of the total students with the correct answer. Child presents with soreness in the mouth, rash on the hands, feet, as shown in the image. What is the causative organism for this particular condition? What is the causative organism for this particular condition? Please remember it's a case of hand, foot, and mouth disease. And for HFMD, the causative agent is what? Coxsackie A16. Okay? Coxsackie A16. So with this, we are done with the today's session. I hope everybody have enjoyed. If you like this class, please subscribe to Unacademy. Use my code Chesta10. Very important. This will give you 10% additional discount. And please remember, if somebody is telling you that they can give you additional 10% discount, please remember that that is not true. Unacademy officials only give 10% discounts until unless some scholarships are going on. Otherwise, more than 10% if anybody is claiming, that is spam or that is fake. So please do not come, because I have many students who come into this, like this fake scam, and they have lost their money. Tomorrow I will not take any class. So now we will have class directly on Monday. Tomorrow I think we'll have no class. Clear? So please remember the timings are. I will make sure that the classes will be at 2:30 p.m. every day except Sunday. 2:30 p.m. every day except Sunday. Today, because of marathon, I have to take it at 4 p.m. Otherwise, I could have taken it 2:30 as well. Okay? So every day 2:30 p.m. to 3:30 p.m. Okay? Chalo. So bye all of you. Please subscribe to Unacademy. I am waiting for all of you on Monday 2:30 p.m. Till then, bye. Take care and good day.